Campbell Hall. And I've been at the food bank since 2011 when my postdoc got done here, and I didn't really think that I'd ever be kind of working in a food bank and food insecurity, but it's been like a really good career path for me. So there was no job there like this before I started, so it's allowed me to kind of like create my own job and move into like connecting food and health. So how many of you guys have ever been down to the food bank before? Anybody been down there before? Do you know what a food bank is? Does anybody like know what a food bank is? Have you ever visited a food bank outside of like the ones that are here? Anybody? Like raise your hand if you have. Okay, so in case you don't know, so there's a difference between a food bank and a food pantry. How many of you have ever been to a food pantry before? Anybody? Okay, so the difference between a food bank and a food pantry. Food bank is like a giant warehouse. We are the ones that source excess food, surplus food, we buy food, things like this. I mean, I'm talking food like by the semi-load. And when it rains, it pours, usually at the food bank. Like we're talking beets by the semi-load. It's usually not all that, but so we house the food, and then we have over 650 what we call partner agencies, and those are our food pantries, our soup kitchens, after-school programs, and things like that. And so if you're one of those, what we call agencies, you actually acquire your food from the food bank. So we're kind of like the warehouse distributor type to our food pantries. And then if you're in need, you can go to a food pantry or soup kitchen or whatever, produce market, and acquire food that way. So that's kind of like just briefly how our system works. And so when I started at the food bank, so I'm a dietitian, as well as, I have a research background. And when I started at the food bank, we did a lot of work with diabetes, and we were doing some work with Feeding America and the Bristol Myers Squibb Foundation to take a first look at what happens when you start to take folks that are being seen at a federally qualified health center. Has anybody ever heard of a federally qualified health center? Anybody heard of that before? Okay, so just let me, push pause for 1 second here. And what's your guys' background? Like, how many science, health people do we have in here? How many, computer science people? English, language arts type? What do we have going on in here? I don't even know what your guys' backgrounds are.
Yeah, so we have a pretty good divide of people. I would say majority are probably public health, or are interested in public health somehow. Is that accurate? Yeah. Raise your hand if you're in public health.
Public health? Okay.
Yeah.
All right, good. And what's the other, half of you?
I'm econ and English.
Okay, that's good.
Being in neuroscience.
Okay, great.
Biochemistry.
Okay, biochem. So, okay, good. So we have a lot of science people in here. All right, well anyways, let me pick back up. So federally qualified health center, if you're in public health, you need to know about this. A federally qualified health center is actually, it's like a regular doctor's office, but it's heavily funded by the Centers for Medicare and Medicaid Services. They're often in locations in a county. Not all counties have a federally qualified health center. You have to be a county that has enough population that meets the poverty level or the current income level to have a federally qualified health center. And basically, they provide great health services to people on a sliding fee scale. They oftentimes see a lot of self-pay folks. They see a lot of Medicaid, Medicare population. And so in Franklin County, we actually have 4 federally qualified health center kind of branches. We have Primary One Health. We work with, Mid-Ohio Food Bank works with them a lot. We have Heart of Ohio Family Health Center. We have Lower Lights Christian Health Center, and then we have Southeast. Those are the 4 federally qualified health centers in Franklin County. They see a large population of the same folks that we're seeing at the food bank. Anyway, so we started this work with Primary One, the federally qualified health center, 4 or 5 years ago. And basically what we learned out of this diabetes study was that when you connect people that are food insecure with healthful foods, they have improvements in their health outcomes related to diabetes. Not only clinical, but they also have psychosocial improvements in their health outcomes. We also learned from the people that were participating in the project that, the food was great, but what they really needed was connection to produce. And that was probably the #1 thing that, people commented on of the types of food that they received. People don't purchase produce because it's expensive for their budget. Or not only that too, but sometimes you have to think about transportation issues and how the people getting it home and all this. There's lots of plethora of other things that come into play when you have limited resources. Are you taking the bus? Are you trucking 3 kids along? All this other kinds of stuff that comes into play. So basically what we learned from that was that, okay, food helps people have better health outcomes, particularly produce, and our clients like produce. And we have a ton of produce at Middle Ohio Food Bank. If you've never been down there, I forget like what I have on my slides here, but we, let me pull it up here. We have, anyway, we distribute in fiscal year 2016, so that was what, 2015 till like July of 2016. So I don't know what it's going to be this year. We distributed about 30 million pounds of produce. We're the 6th largest produce distributing food bank in the United States. We have a lot of produce, and not only that, but we have a lot of great partner agencies that have really stepped up to figure out how do you like not know what kind of produce you're going to get, and then figure out how to get it and get it out to people in a timely manner so it doesn't rot in your warehouse. So we really had to kind of rethink some of our distribution strategies to get all that stuff out. So anyway, this is kind of background on the food bank and what's going on. So some of you know about Pantry Trak, and that's what we're going to like primarily talk about tonight. So let me back up to like connecting people with produce. So we learned that people want to connect with produce. So we went with primary one, and we went through a lot of iterations of, how do we like screen people at the doctor's office and get them connected to produce. So, hence was born the produce prescription, because all of our agencies that are getting out all this produce, they're already doing the job. They already have the food that people need. We just need to get the people aware of, am I food insecure, and how do I like figure out where I can access this produce for free. So hence was born our produce prescription program. We've gone through a lot of different iterations of this. We've tried like paper prescription, we've tried faxing things to the food pantry. I can't even tell you like the number of different versions of this that we have had. And basically what we figured out was that when you hand somebody a piece of paper or you fax a piece of paper to a food pantry, it gets lost in the circular file, people forget it, you name it. And so we needed to like electronic this whole scenario. Which is, what I've worked with James and some of you have met Mark and David on our Pantry Trak team. So we have this system at Mid-Ohio, and it's called Pantry Trak. And it was initially started, have you guys heard of Pantry Trak? I mean, some of you may have heard of it. Basically, it was initially generated or created to replace a paper form when you go to a food pantry. Normally when you go to a food pantry, you have to like sign this paper form every single time you went, and you had to sign one at every single different food pantry that you went to. Well, it was a giant pain in the neck for reporting, so Mark, who is an IT person by trade, developed a program. It's online. I don't know if you call it a program, software, I don't know what you would really call it, but called Pantry Trak, and it basically legally takes the place of the TFAP form through the Ohio Department of Job and Family Services. So now when somebody visits a food pantry, they just have to produce like their ID and their proof of residence and all that kind of stuff that you need one time per year, and then their name is entered into our Pantry Trak database. So that way when they visit a food pantry like on South Champion Avenue, and then the next month they go to the west side, the person on the west side just has to type their name in, and all of their information is already in there. It makes life a whole lot easier for the folks that are getting food and for the people that are like working at the food pantry. It's just like way more efficient. And that way we can also start to understand, how often are people accessing food, where are they accessing food, that kind of thing, what types of food are they accessing. So we worked with Mark and some other folks to say, okay, is there a way that we can get some kind of like electronic prescription to go through Pantry Trak to our food pantries. So that's where we're at now when it comes to our produce prescription. And so I know that you guys have some other like desires for screening people and putting some information in here, and so we're going to talk with Tom, and I don't know, what is your name again?
Garrett.
Garrett. We're going to talk with Tom and Garrett like some other time, not today. So we're just going to worry about food insecurity screening today, because that is actually one of the things that, for the food bank, we do food. We're concerned about the other needs of individuals as well, but food is something that we can impact, and so that's why we're working with food insecurity screening today. So let me just go briefly. Food security. How many of you, in your public health classes, do you guys talk about food insecurity, food security, and all social determinants, all that kind of stuff? So If anybody doesn't know, social determinants, okay, are the things that beyond like the normal health care or whatever, this is like your environment, your family, food, housing, all the other kind of stuff that contributes to health outcomes outside of, like taking drugs or visiting your doctor. So food security and food insecurity actually falls into that social determinants category. So we see here that food security is really access to enough food, allow people at all times for a healthy life. Food insecurity is that limited or uncertain access to adequate food. So just kind of generally speaking, in the U.S., we've actually seen a little bit of improvement in food insecurity over the last year or so. About until like the economic crisis, so like 2007, 2008, it was kind of running around 11% of the population was food insecure, and then we saw an increase up to about like 15-ish% of the population. It's actually improved a little bit over the last year to down like to 14, 13%. But Ohio actually is kind of like really bad on their food insecurity. We're still at like 16, and in Franklin County, we're still at 17% of the population's considered food insecure. So it really is a major issue for a lot of people, just even around Columbus. So cycle of food insecurity and chronic disease. This is one of the things, I don't know if you've covered this before, but a lot of people are like, well, why are food banks even interested in this? The thing is like we have the capacity to acquire excess produce. So this produce is not necessarily the grade A, like perfectly round apple that you'll see at the grocery store, but this produce is like maybe a little lopsided, but still perfectly nutritionally sound and can give health benefits to folks. So basically, like if you have a chronic disease, let's say for the example, this example is diabetes. If you have diabetes and you are food insecure, you have times of plenty when you like have enough money to buy food so you get what you want. And when you're in times of plenty, but you have remembered times of need, what is your kind of like natural reaction to do in times of plenty? What would you think? If you have plenty of food around, and you remember times when you haven't had food around, what's kind of your reaction to do with that food that you have? Anybody have an idea? What?
Save it.
You're going to overeat it. Hey, or save it. Yeah, you're just going to like, oh yeah, tons of food around, so I'm going to eat it. Well, when you have diabetes or any other kind of chronic disease, it's not necessarily good when it comes to like weight management and that kind of thing. So you have this fluctuation of times of plenty, times of need, times of plenty, times of need. And so anyway, you have this poor self-management type of thing going on. When you have poor self-management, you visit your physician more often. Physician says, whoa, A1C is out of control, let me prescribe you more medication. So you have this like, now I have to decide whether I'm going to buy my medication or buy my food. So you have these competing demands going on. And so if you have competing demands, say for example, you run out of food at the end of the month, but you're still going to take your medication, and you end up with a diabetic low, and you end up in the ER, so they lead to the hospital, you have more competing demands. It's just this crazy cycle. And so the good thing is that food banks have the capacity, and we have the opportunity really to intervene here before folks kind of get into this crazy cycle of food insecurity and chronic disease. Just let me give you a little bit of background on this. I know I talked a little bit about the produce prescription, and we distribute 30 million pounds of produce annually, but in Franklin County, so this is pretty, so you guys are going to be our 5th referring agency. We have 4 referring agencies right now. We have Primary One, it's an FQHC. We have Heart of Ohio Family Health Center, it's another FQHC. The Charitable Pharmacy of Central Ohio is now referring as well, and there's one more, I forget what it is. Let me think about who it is. Physicians Care Connection downtown. It's a free clinic that's on Monday nights. They're our 4th referring agency in Franklin County. We have some other, in 4 other counties that are doing this. And so basically these agencies or these healthcare providers are starting to screen and document food insecurity status in the patient's medical record. And then what they're doing is in some fashion they're sending a produce prescription. There's a couple of different ways. We're going to work with the Pantry Trak way tonight. And basically what that does is that at the provider's office, the patient's like, okay, I know I can go to this list of, we have like, I think 13 participating food pantries right now that are produce prescription kind of like fill sites, our pharmacies. And they know that they can go to any of those places, and if they have a produce prescription, they can access fresh produce during the hours of operation for those agencies at least one time per week. That's what we ask the food pantries to do, to make produce available on a weekly basis to people that have a produce prescription. A lot of these food pantries are actually doing it for whoever walks in, like once per week folks can access produce. So that's really what the background is on it right now. And then the benefit then, so I don't know like what all you guys cover in your classes, but one of the things that providers are very interested in is, some of the changes in the Affordable Care Act is a little bit more accountability on the provider's part, where they have to make sure that they've taken like a lot of effort in order to treat the disease that that individual has. So food plays a major role in that. But many people, like produce prescription is not a new idea. There's a lot of people that are like screening and referring people to food. But we're the only site, James, is that right? We're the only people in the US, I think, that have this whole thing going on. Because how do you know, like when somebody goes to a food pantry, if you just hand them a piece of paper? I mean, there's really no way to know that. And so basically what this does is it allows the healthcare provider, once they have that prescription and it's entered into Pantry Trak, since all of our food pantries also use Pantry Trak, when the patient shows up, hi Mr. Smith, they search Mr. Smith in the Pantry Trak database, and that way when that patient connects with produce, the provider can run a report and see like who they referred that's connected with food and who they referred that hasn't connected with food. We have our primary one folks are actually, they have an MHA, I think through this school, that's working with them to kind of like see like who's connected and who hasn't connected, like what are the reasons why you've connected versus not. So anyway, that's just a little bit of background on why this is important. And what we hope that it leads to is to show that, are the people that are connecting more often with food having any kind of improvements in their health outcomes, or not only their health outcomes, but does it give them more bandwidth to actually like get in the car and get to their doctor? Does it free up more funds? Does it help them actually manage their life a little bit better? So there's a lot of things that we want to look at in the future with this. Let me see here. Okay, so the next thing that I want to talk about is food insecurity screening. So I saw this big list of things that you guys want to screen for, and somebody told me that it's going into some electronic, like online something or other. Is that right? Am I making that up?
Yeah. So we use Food Bank Manager right
What's
now.
it called?
It's called Food Bank Manager.
Okay.
And we use that as like our online database right now.
And does that have all of those like things you're screening for? Okay. Anyway, I don't know about that, but let's say a Food Bank Manager. So I saw some of the things. One of the things that I do want to recommend for you when it comes to food insecurity screening is so. In 2010, there was a paper that was published by Hagar. Do I have it up here? Oh yeah, in 2010. And then just this year, so in Hagar's paper, it was actually looking, do you guys know this already? Have you heard this? Okay. So in Hagar's paper, what they did, so food insecurity screening, just as briefly, do you guys know how food insecurity screening happens in the U.S.? Like how do we determine food insecurity status in the U.S. or how much of the U.S. is food insecure? So the Census Bureau has this thing that they do, it's called the Current Population Survey. It's ongoing, it happens every single month of the year. Well, anyway, every December, they have kind of like a subset of the population that they're going to screen. And the USDA has what's an 18-item food insecurity screener. You can log on to the USDA's website and download it, and they have like 3 different versions of it. Well, anyway, the 18-item screener is what the Census Bureau uses every December to screen 45,000 individuals in the U.S., like randomly selected. And basically from that 18-item screener, that's where those things of like, 15, 14% of the U.S. population is food secure. That's where that information comes from. Well, anyway, Hagar, the person that did this first paper, recognized that to ask a physician or a nurse or whoever at a healthcare provider to do an 18-item screener was not going to happen. And so they looked at a patient population with families with children, and they basically took that 18-item screener and were able to, and I don't know the procedure that they used, I'd have to read the paper again, but they were basically able to narrow the 18-item screener down to 2 questions from that screener that was able to distinguish if a family was food insecure. So the 2 questions are here, and these are from that 18-item screener that the Census Bureau and the USDA uses. The first question is, we worried, you would ask this to an individual, we worried whether our food would run out before we got money to buy more. For you in the last year, was that often true, sometimes true, or never true for your household in the last 12 months? The second question is, the food we bought just didn't last, so we didn't have any money to get more. Was that often, sometimes, or never true for your household in the last 12 months? So if a patient would answer often true or sometimes true to either of those questions, does it have to be both?